Cosmetic Networks Live, where we explore the aesthetic and the cosmetic industry from the inside out. Hi, I'm your host, Sheila Maitland, and this is Friday, August 15th, 2014, episode 114. We have a very special panel discussion today I want to share with you. I want to introduce to you board-certified cosmetic dentist Dr. Douglas Hauck. Welcome,
Hello.
Dr. Hauck.
Hi.
And board-certified plastic surgeon in San Diego, Dr. G. Welcome, Dr. G.
Thank you. It's nice to be here.
Hey, we're so excited about this. This is our first panel discussion, and we have got some great topics that are going to affect many of the viewers that really want to know about the full facial rejuvenation and the aspects of how dentistry actually affects the plastic surgery part and how they go hand in hand. But first, let's start with Dr. Hauck. Share with the viewers what inspired you to be a cosmetic dentist.
You know, it was a passion. It's been in my family, and I didn't want to be like my parents, but they're all dentists, and it just happened to come that way. So I love recreating and helping people find their way and find the best out of themselves. 20 years in Beverly Hills, now in Newport Beach. I've done a lot of interesting folks, and it's a fun journey is what it is. It's the striving for education, and every time I do a great procedure, it makes me feel good, it makes them feel good. So it's a win-win.
That's great. And Dr. G, what inspired you to be a board-certified plastic surgeon and took you to San Diego?
Well, I think way back when I was a kid, I always had this curiosity about things, and especially living things, and what was inside them. So I always knew I was going to be a surgeon. I tell people the story that when I was a kid, I used to steal chicken hearts and chicken livers from my mom while she was cooking and take them down in the basement and dissect them because I had to see what was inside them. And I think that just sort of led one thing into the next as my education progressed, and I started learning more and more about surgical careers. I happened on plastic surgery because it's got a beautiful combination of artistic, aesthetic sensibilities, and yet it's also very analytical and scientific, and it's totally surgical. I do very little non-surgical treatment of people, so technical skills are very important, and all of those things appeal to me.
Right. So also share, what are some of your hobbies? What are some things that you do that you're really passionate about outside the practice?
Well, I'm a fitness buff. I think part of beauty is fitness and health, and so I was a college athlete at one time long ago in my life, but I've kind of carried those habits through, right. So I like exercise. But then I also share an interest with Dr. Hauck in food and wine. I know I don't look like it, but I'm somewhat of a foodie, and I love good wine too. So
that's great. Okay, so Dr. Hauck, share this backing of you and your wine.
I love it. He jumped right in there. Yes, well, I make wine as a hobby. I grow it, I make it, I sell it, I consume it occasionally, and fine wine.
Send it in our way.
We would respect you if you did.
Right? Yeah.
That's awesome. Well, our topics today are going to be in regards to teeth and face, how they go hand in hand, and how a woman or a man that wants the full facial beauty and what their expectations are, and how the two of them go together. So, Dr. Hauck, let's start with you. How does a person's teeth and jaw affect the way a person's facial appearance is?
Well, it's really critical to have symmetry and balance from the outside. But how do we really get that? And we were talking about this earlier, that aesthetically for me, we need a perfect foundation, or at least as close to perfect as we can get. Now, some people maybe don't have back teeth, or they don't have front teeth. And you know when you look at that person, something's a little askew. Or maybe their jaws are in the wrong position. So we have to, in my practice, try and find a way to recreate the foundation. And there we can build beauty on top of the proper foundation. And so we do work with plastic surgeons hand in hand, saying on a panel, what do we do here? How do we get this person where we want them to go? Dentally, I can do this, but I might need some help of a plastic surgeon to help me get there. And I might do my treatment first, or vice versa. He might have to help me before I start. And that's why this cross-pollination of specialties is really critical. I think that if we could do more people got involved, it would be better.
Right. And also, Dr. Hauck, how do you approach the treatment when you realize that there's more than just the mouth that they need to have improved for that full restoration? How do you approach them in that conversation?
Carefully, cautiously, but you have to go there because maybe they think that, I think this just happened the other day. I had a beautiful young girl, she was 20 years old, and her teeth were moving. They were all spreading out, and they were all gaps. And the mom was there, and she said, "Why does my daughter have gaps? She just had braces." Well, because the foundation was pushing and banging into the teeth, and it messed everything up. So I had to sit her down and say, well, look, we have a situation here. Your foundation is off. We have to change this. And then we're going to do that and then put a smile on top of that. So you have to create that foundation.
Also, it's important probably knowing what the expectation of the patient has for themselves, whether they want a full face, plan in place, because if they're young at 20, they might not necessarily be thinking that far down the road, but yet that they are into fashion and into beauty, and you need to set that expectation for them and lead them.
Yeah, we have to do that on our first consultation and spend as much time as possible to find out where their expectations are, because maybe they just have one tooth that's a little bit funny when that's not really the problem. So finding out the levels of expectations and figuring out where we should stop and also where we should suggest the optimal treatment. We can't shorten ourselves. We have to give them all the possibilities.
Right.
And that takes time. Time is what it really takes, and the profession needs to take time.
Right. So, Dr. G, would you please share your approach in your treatment when you realize that the patient needs also mouth, jaw work, not just what you're going to do with plastic surgery, that they need that full facial attention?
Yes. Well, I'd like to follow up on a couple of the concepts that Dr. Hauck started off nicely with, and one of those is the idea of expectations. So, we have to sort of delve into what the patient is here to see us about. What do they want? And then we have to use our expertise also maybe to guide them into things that they may not see for themselves, especially when we're talking about functional needs as opposed to just aesthetic needs, because a lot of times people don't really pick up on some of the functional issues that they may have that may be creating some of the aesthetic needs. So once we sort of establish where their goals are and what they want, then we can start setting expectations for both of us, the patients and all of the caregivers. Just because we can do something doesn't necessarily mean that we should or that we want to. So once we kind of establish a plan based on patient expectations and needs, then I'd like to segue into the next concept that he started on, and that is the analogy of sort of a building process. So if you think of building a house, as you said, you're not going to start with the finish work and put shingles on the roof and shutters without having a good, strong foundation. And so for me as a plastic surgeon, the perioral or around the mouth area is in need of good foundation. And we think a lot of times of the soft tissues in the face, thinking in terms of volume. As things start to lose volume, they collapse in. So, just think of a person, the proverbial old grandma who's edentulous or doesn't have any teeth and her mouth is all sucked in, And if you just put in some dentures or if you do a full mouth reconstruction, it adds volume back, and all of a sudden her lips and the tissues around her mouth fill back out. So I tend to look at the volume of the soft tissues overlying the structure too, and try to come up with a plan that works in concert with what the dentists are going to do.
That's great. That's great. So as professionals, let's start with you, Dr. Hauck. How would you work together to coordinate the best plan for your patient?
That's a great question, and I think it actually goes both ways. So cross-pollinations of our specialties, what we talked about earlier, and to set up a case, and then for me to recognize there are some areas of professionalism I don't know. So I have to say, this is what I can do, and here's my problem, and then hand it off to a plastic surgeon and say, what can you do to help me? And then vice versa. And then if we kind of try to build up the case, and he gives me his input, my input, and maybe a derm's input, so on and so forth, we can build an entire end game if that's what the patient desires.
Right. And Dr. G, do you want to add to that?
Yes, I would take the same approach just from the other side of the relationship, and knowing that the teeth are important. When a person smiles, it's one of the first things we see, and we all appreciate seeing a beautiful smile, and yet that's not something that's in my scope of practice. But if I know they can add to the patient's beauty, or it sort of is consistent with what they express as their needs or goals, then I'll factor that into the plan for the patient.
Right. I would think it'd be kind of silly if a person came in for a full facelift and they had a chipped tooth, or they had very crooked teeth or missing teeth. For that, if they're conscious enough to want to have that facelift, and they need the finished result with the teeth as well.
Absolutely.
Let's talk about for you, Dr. G, how has the betrayal of plastic surgery in the media affected your practice?
Did you say betrayal or portrayal? No, no, you did. I just want, I'm being funny there, but really there's sort of a love-hate relationship there, in my opinion, with the media and plastic surgery. If you think back many years ago, the public really never got to see inside of the operating room. It was kind of a sanctum sanctorum. It was a private place where we did this sacred thing on our patients, and with Extreme Makeover and then follow-on shows like The Swan and that kind of stuff, it opened that up, and all of a sudden the public got to see an inside glimpse of what we do. They were invited into the operating room. They saw blood on the field and liposuction going on and all of this stuff, and it was very entertaining. And with that kind of came the personalities and the sort of off-color conversations and discussions and stuff like that sort of is consistent with the entertainment community, but may not always show plastic surgery in the best light. So, I can make a case in point right now. One of the hot shows on TV is a show called Botched, and the premise is that patients have complications from their aesthetic surgery, and they go to get those corrected, and the surgeons do revisional surgery. And fundamentally that's a great concept, and it certainly is something that's worthwhile. I mean, when patients have complications, they need revisions.
Right.
The problem is that the media hype that kind of comes along with that, the word botch is a very inflammatory word, and all of us plastic surgeons have to admit, unless we're not operating enough, that we have our share of complications. And it's not whether a plastic surgeon has complications, it's how he deals with them. And the problem with these kind of inflammatory terms and the treatment of that is that now every complication becomes a botched operation, because the word is kind of in the zeitgeist. It's now in the public vocabulary. And so, like I said, I think it's a great thing that, the media portrays plastic surgery, because it's a wonderful specialty. It helps people immensely. But I sort of have a love-hate relationship with it myself, personally.
Right, and I can see both points, that for sure, that the positive is that people are talking about plastic surgery, and it's more okay to have it done now. And so some of that guilt that some people may be carrying has gone away, because
Absolutely.
It's socially acceptable now to take care of yourself and really care about yourself. But then when you do bring in a twist with maybe a show like Botched and that word, it can kind of do a backspin.
Yeah, and we just have to realize that this is medical care that we're talking about. I mean, these people take on very real risks.
Yes.
There's expense involved. As we've said, there's sometimes complications that happen. Right. And we really have to treat it with the dignity that it deserves.
Exactly. Thank you for sharing that. Dr. Hauck, I want you to share with us, for example, how do shows like The Housewives affect your practice? Like, do patients come in and say, I want her teeth?
All the time. They really do.
So do you ask them to bring pictures in, or how do you address that?
They always bring in pictures of I want to look like J-Lo, or I want this, or I want that. And it's hard for us to tell them that sometimes we can't deliver what their expectation is. And they tear out a photo out of a magazine, and I'm sorry, Mrs. So-and-so, that's not going to work for you.
Mm-hmm. And that might be because?
Their lips are in different locations, their chin is different, their skin's different, their genealogy is different, so on and so forth. It is really hard to give them that one smile or that one situation. And same in plastic surgery, I'm sure, as well. Yeah. So we had to kind of get them back to reality in a nice way, and kind of bring them back to where they're at and who they are, like we talked about earlier, and say, well, this is what is possible. And then we quite often do before and after photos right there on the spot, so they get a little preview. This is where you're at this minute, and in a couple of weeks you could be like that. It's a kind of an interesting journey, and it takes a little time for them to digest what the possibilities are sometimes. Right. But just like the show you were talking about, I thought that was a really good rebuttal to her comments on the show, by the way. Well done.
Yeah, that's good.
But that show does bring up some things to talk about. Right. We're talking about it right now, which I think is fantastic. Mm-hmm. It does tarnish the profession occasionally, maybe a little bit, but we're out discussing it, and I think that's great.
Right, it is. So anything else you gentlemen want to share about each other and how you can work together, and how patients can know that they can be confident that you're going to be out for their best beauty, because you have relationships like this right here?
Well, being in San Diego, and if I'm in Newport or Los Angeles, I think Skype is the answer now.
Yeah, that's right.
We can send down before and after photos, and I can say, what's your opinion on this? Or I have a patient down in his area, or vice versa. I think the new technology is to get on board, start talking about things together. Use your friends who are specialists in different areas that you're not well trained at, and get talking about these things and start cross-pollinating our professions if we can.
Right, I agree.
Well, the great thing about specialization is it allows us to delve deeper into one area where we can gain more knowledge in that one focused area, and then let our colleagues in other professions do the same thing on their side, and we don't have to know everything. And I think what that does is it raises the bar on the level of care that everybody can achieve.
Right.
And if we think in terms of more of a comprehensive approach to beauty, then it makes sense to treat the teeth and the dentition and the jaws the same way as we would the soft tissues of the face as well.
Exactly, and as a patient, I would love knowing I have two professionals looking after my best totally revision and reconstruction of my face, or rejuvenation is really the right word, and knowing that the two of you are talking together too, and to really focusing it down to what's really best for the patient. So
Now, the second episode, let's talk about food and wine.
Food and wine, we will.
I'm on.
Thank you so much, Jennifer, Ben, for being on our show. For those of you who want to learn more about the cosmetic and the aesthetic industry, you can visit us online at cosmeticnetworks.com. And until next time, we hope you have a beautiful week.